What if the reason your hormone therapy isn't working is not because hormones don't work? What if the real problem is the root? The way it enters your body, the way it travels, the way it gets processed, and whether it ever reaches the tissue that is actually asking for help. Because many women are told the same thing: take this pill, try this patch, use this hormone therapy. This should help your menopause symptoms, and sometimes it does help. The hot flashes may soften, the night sweats may calm down, sleep may improve, mood may feel steadier. But then, one symptom stays: the dryness, the burning, the irritation, the fragile feeling, the pain with intimacy, the feeling that something down there has changed in a way nobody warned you about. And you think, why is this still happening? Is my HRT not strong enough? Do I need more hormones? Is this just aging? Is this my life now? But what if the issue is not that your body needs more? What if your body needs the right treatment in the right place? Today, we're talking about why many hormone therapies don't fully solve vaginal menopause symptoms, and why local vaginal hormone cream may be the missing root many women were never told to ask about. No brand names, no shame, no miracle claims. Just the difference between hormones that travel through the whole body and hormones that are applied directly where the symptoms live. This video is for education only and is not medical advice. Always speak with your doctor or qualified healthcare provider before starting, stopping, or changing hormone therapy. But if you have been on hormone therapy and still feel dry, sore, irritated, or disconnected from your body, stay with me, because this may change the question you ask your doctor. Not, why is my body failing? But, is my treatment reaching the tissue that needs support? Menopause is often explained as a hormone problem, but that is only half the story. Because when estrogen changes, your tissues change too. The vaginal tissue can become thinner, drier, less elastic, more sensitive, more easily irritated. The vulva can feel sore or fragile. The urethra and bladder can become more reactive. Sex can become uncomfortable or painful. Even daily things, walking, sitting, wiping, wearing tight clothes, can start to feel different. Doctors often call this genitourinary syndrome of menopause, or GSM. It can affect the vagina, vulva, bladder, urethra, urinary comfort, and sexual comfort after estrogen levels decline. Low-dose vaginal estrogen is commonly used for these local menopause symptoms when appropriate. But many women are never told this clearly. They hear about hot flashes. They hear about mood swings. They hear about sleep. They hear about weight gain. But they do not hear enough about what estrogen decline can do to the tissue itself. So when they start HRT and vaginal symptoms remain, they feel confused. Because they think, if I'm already using hormones, shouldn't everything be fixed? And this is where the delivery route matters. Let's talk about oral hormone therapy first. When you swallow a hormone pill, it does not go directly to the vaginal tissue. It goes through your digestive system. Then it passes through the liver before reaching the wider bloodstream. This is known as first-pass metabolism. That does not mean oral hormone therapy is bad. It simply means oral hormones are processed through a systemic route. The hormone has to travel. It has to be absorbed. It has to be metabolized. It has to circulate. And only then does some of it reach different tissues around the body. For some symptoms, that can be helpful. For hot flashes, night sweats, or broader menopause symptoms, systemic hormone therapy can be appropriate for some women. But vaginal dryness is not just a whole body symptom. It is local. The tissue itself is dry. The tissue itself is thin. The tissue itself may be irritated, sore, or painful. So the question becomes, why would we expect a hormone that has to travel through the whole system to always solve a problem that is happening in one very specific place? That is why some women say, My HRT helped my hot flashes, but I'm still dry. Or, my patch helped my sleep, but sex still hurts. Or, my hormones improved some symptoms, but down there, nothing changed. That does not mean you are imagining it. It may mean the treatment route is not targeted enough for the symptom you are trying to treat. Now, let's talk about patches and gels. These are different from oral pills. A patch or gel is absorbed through the skin, so it does not go through the digestive system in the same way an oral pill does. It can avoid the first-pass liver metabolism that happens with oral therapy. So we need to be accurate. Skin-based hormone therapy can be a very useful systemic route for some women, but it is still systemic. It is still designed to circulate through the body. It is not the same as placing treatment directly in the vaginal tissue. That difference matters, because with vaginal symptoms, the issue is often not simply how much hormone is in the body. The issue may be, is the local tissue receiving enough direct support? And this is where vaginal hormone cream becomes different. Vaginal hormone cream is applied locally. That means it is placed directly in or around the vaginal area, depending on the prescription and instructions from your healthcare provider. Instead of swallowing a pill and asking the body to distribute the hormone everywhere, the treatment is delivered close to the tissue where the symptoms are happening. This is why the route is so powerful. It does not have to go through the stomach first. It does not rely on digestion. It does not need to pass through the liver first, like an oral pill. It is not trying to treat the entire body before reaching the area that hurts. It is local. It is targeted. It is closer to the symptom. Vaginal estrogen is described by the NHS as a local HRT used for menopause symptoms such as vaginal dryness and irritation, with low dose and little of the medicine getting into the rest of the body. It can take up to 3 months to work fully. And Mayo Clinic explains that vaginal estrogen goes directly into the vaginal tissues. Compared with estrogen taken by mouth, it works at lower doses, limits overall estrogen exposure, and may provide better direct relief of symptoms. That is the key. Not necessarily more hormone, not necessarily stronger hormone, but a more direct route. Think of it like this. If your eyes are dry, you don't take a body lotion and hope it reaches your eyes. You use eye drops. If your lips are cracked, you do not put lip balm on your shoulder. You apply it to the lips. If your hands are dry, you do not moisturize your knee. You treat the tissue that needs help. So if the vaginal tissue is dry, thin, irritated, or painful, it makes sense to ask, does this tissue need local treatment? That is why local vaginal cream can be such an important conversation. It is not because systemic HRT is useless. It is because systemic HRT and local vaginal treatment are doing different jobs. One is broad. One is local. One travels. One targets. One may help whole body symptoms. The other may support the tissue where dryness, burning, irritation, and painful intimacy are happening. And here is where many women lose years. They keep changing the wrong thing. They increase or adjust systemic hormones. They switch from one route to another. They try supplements. They try lubricants. They try to ignore it. They tell themselves, maybe this is normal. Maybe I am just older. Maybe intimacy is supposed to hurt now. Maybe I should just accept it. But what if the missing piece was never willpower? What if it was never shame? What if it was never that you were no longer feminine, desirable, or healthy? What if the missing piece was simply that local symptoms need local support? For bothersome genitourinary symptoms of menopause that are not relieved by over-the-counter therapies, the Menopause Society's 2022 position statement recommends low-dose vaginal estrogen therapy or other options for appropriate women, especially when systemic therapy is not otherwise indicated. This does not mean every woman needs vaginal hormone cream. It means persistent vaginal symptoms deserve a real medical conversation, not silence, not embarrassment, not Just use lube and live with it, a real conversation. Now, lubricants and moisturizers can absolutely help. Lubricants reduce friction during intimacy. Vaginal moisturizers can support ongoing comfort. For mild symptoms, these may be enough for some women. But if the tissue itself has changed, if it feels thin, sore, fragile, burning, or painful, then lubrication alone may not solve the deeper tissue issue. A lubricant helps with glide. A moisturizer helps with hydration. But vaginal hormone cream is intended to support estrogen-sensitive tissue changes locally. Different tool, different purpose, different route. And for many women, that is the difference nobody explained. Let's bring this into real life. A woman starts HRT, her hot flashes improve, she sleeps better, she feels less emotionally volatile. So on paper, the treatment is working. But privately, she still has pain with sex. She still feels dry. She still feels burning after intimacy. She still avoids closeness because her body is bracing for discomfort. And she thinks, something must be wrong with me, but maybe nothing is wrong with her. Maybe her systemic symptoms improved, but her vaginal tissue still needs local care. Mayo Clinic notes that even if someone is already using hormone therapy pills or patches, a healthcare professional may suggest low-dose vaginal estrogen if vaginal dryness and related symptoms continue. That sentence matters because it validates what so many women experience. You can be on HRT and still need local treatment. That is not failure. That is precision. Now let's talk about desire. Because many women think vaginal dryness is only about sex. It is not. It is about comfort. It is about tissue health. It is about daily life. It is about feeling at home in your body. But yes, intimacy can be deeply affected. And when intimacy hurts, desire often changes. Not because desire is gone forever, but because the body is intelligent. If something hurts, the body protects. If touch leads to burning, the body remembers. If penetration feels painful, the nervous system may begin to anticipate pain before intimacy even starts. So a woman may think, I lost desire, but sometimes desire is buried under discomfort. Sometimes the first step is not forcing romance. Sometimes the first step is restoring comfort, restoring moisture, restoring trust, restoring the sense that your body is not a place of pain. That is why vaginal symptoms are not minor. They affect relationships. They affect confidence. They affect identity. They affect how a woman feels in her own skin. And they deserve serious care. So, why do most hormone therapies not work for this? Because many hormone therapies are not designed to be local. Oral pills go through digestion and liver processing before systemic circulation. Patches and gels may avoid first-pass liver metabolism, but they still work systemically. And systemic therapy may not always provide enough direct support to vaginal tissue. But vaginal cream is different. It is applied locally. It reaches the tissue more directly. It uses a lower-dose local approach, and it is designed for symptoms like vaginal dryness, irritation, and local menopausal tissue changes. That is why the root matters. Because sometimes the body does not need more noise in the system. Sometimes it needs a whisper in the right place. Here are the questions to ask your doctor. You can say, I am on HRT, but I still have vaginal dryness. Could this be genitourinary syndrome of menopause? You can ask, would local vaginal hormone cream be appropriate for my symptoms? You can ask, what is the difference between systemic HRT and local vaginal estrogen? You can ask, would a cream, tablet, ring, moisturizer, or lubricant be best for me? You can ask, is this safe with my medical history? You can ask, how long should I use it before judging whether it works? You can ask, what symptoms should prompt me to come back sooner? And please remember, if you have unexplained bleeding, severe pain, unusual discharge, recurrent infections, a history of estrogen-sensitive cancer, or complex medical concerns, you should discuss this carefully with a qualified healthcare provider. This video is not telling you what to use. It is giving you the language to ask a better question. Because many women do not need to suffer. They need to be heard. And this is the truth I want you to remember. Vaginal dryness after menopause is not embarrassing. Pain with intimacy is not something you should just tolerate. Burning, soreness, irritation, and tissue fragility are not signs that you are less of a woman. They are symptoms. They are healthcare. They are worth discussing. You are allowed to ask for local support. You are allowed to say, "This still hurts. This is affecting my relationship. This is affecting my confidence. This is affecting how I feel in my body." And you are allowed to expect more than silence. If this video helped you understand why your menopause symptoms may not be improving, subscribe to Hormonal Balance Institute. This channel is here for women over 45 who want clear menopause education, gentle movement, nervous system support, and a more compassionate relationship with their changing body. We talk about the things many women are too embarrassed to bring up: dryness, pain, exhaustion, weight changes, mood shifts, pelvic floor tension, and the quiet fear of not feeling like yourself anymore. Subscribe if you are ready to stop blaming your body and start understanding what it needs. And if your body feels tired, stiff, disconnected, or heavy during menopause, continue with the 5-day Asian Pilates Reset for Menopause playlist on this channel. It is a gentle place to begin again. Through breath, soft movement, core awareness, nervous system calm, and the feeling that your body is not your enemy. Because menopause support is not only about hormones, it is also about how you move, how you breathe, and how safe your body feels from the inside. So the next time you hear, "Why isn't my HRT working?" pause and ask, which symptom are we treating? Which tissue needs support? And is the treatment reaching that tissue directly? Because many hormone therapies can help. But not every hormone therapy solves every symptom. For vaginal dryness, irritation, burning, and painful intimacy, the missing piece may be local. Not more, not louder, not stronger. Closer. Closer to the tissue. Closer to the symptom. Closer to the body that has been asking to be understood. You are not broken. You are not dried up. You are not past help. You are changing, and your care should change with you. Take one slow breath, place one hand on your heart, and remind yourself, my symptoms are not shameful. My body is not embarrassing. I am allowed to ask for support. That is where healing begins. Not in silence, but in understanding.